Dr. Farzad, Mostashari. I'm the National Coordinator for Health IT. I'm going to talk about the true meaning of meaningful use. What most of you know is that medicine today is practiced on paper, but that's changing. In 2009, Congress passed the HITECH Act, which put $20 billion towards doctors and hospitals becoming electronic. But they didn't say you get it for installing an electronic health record or EHR. They said you get it for meaningful use of an EHR. So what does that mean? That means that we have to think about the connection between the technology and what is it that the outcome that we want to achieve. Now, this has really captured the imagination. 90% of hospital CIOs say that it's their top 2 priority for the next few years to get to meaningful use. So this is going to happen. Another indicator for this, early indicator for this, is to look at outpatient providers. 2009, 20% of them were on EHRs after 20 years of availability of these systems. In 1 year, it went to 30%. If those trends are continuing, this year it's going to be 40%. In a couple years, it's going to be over 50%. In the next 5 years, we could see the biggest transformation in American medicine that we've had in the past 50 years. But what is this going to mean? Outcomes. This is how we define meaningful use. We said work backwards from what we want to see. We want to see people living longer. We want to see safer care. So let's take living longer. What kills most of us is going to be the biggest preventable thing we can do is for heart attacks. How are we doing on that? Terribly. Only half the time do people do the simple things we know save lives. Cholesterol, blood pressure, aspirin, smoking. So how can we change this? We have to measure what we're doing. You can't fix what you can't see, and doctors today can't see what they're doing. You can't know how many of your patients you're controlling the blood pressure for if you have a room full of paper charts, and that's changing. It means being able to change what you're doing in the visit. When a patient comes whose blood pressure is not well controlled, you need an alert, a reminder. Give them, change their medications, give them the flu shot. It's called decision support. But most transformatively of all, it means stop providing healthcare the way we sell shoes, wait for the person to walk in the door, and then say, how can I help you? It means being able to make a list of your patients and say, who's missing? Who hasn't had the flu shot? Whose blood pressure is out of control? And call them and bring them in. But to do all that, you need this. You need the data. You need structured data, which medicine does not have today, but it's changing because of meaningful use. Number 2, don't kill people.
That's number 2.
We're harming, between 100 and 200,000 people a year in this country. Biggest part of that is medication errors. So what is meaningful use going to do about medication errors? It's going to say, you know what? Put the orders for the medication electronically in the system so that you can get an alert that says there's an interaction here, there's an allergy here. So it can be sent to the pharmacy electronically so you don't have to try to decipher my illegible handwriting. It means medication reconciliation. The other part of meaningful use is patient-centeredness. Right? We all know that most of health doesn't happen in the doctor's office. Most of health happens with the patient. So what is meaningful use going to do for the patient? First of all, we're going to start getting reminders. Not just from our vet and our dentist, but from our doctor. We're going to get reminders. And what that means is that we're going to start to engage more with care between visits. It also means when you go to the visit, when you walk out, you'll have something to hold on to, because most of us forget 50 to 80% of what we heard in the office, if we ever heard it, seconds after we walk out the door. So to have your own information when you walk out. It also means being able to get a copy of your own information when you want it. Things like the blue button protocol, so that you can serve as the medium for the information exchange for care coordination. Because care coordination is a big problem today. We do not have adequate coordination of care, and all too often it falls on the patient to explain what happened. The average primary care doctor has to deal with 126 other professionals. And you know what they don't exchange? Information. That's what they don't exchange, and that's what's in meaningful use. So, summary. Meaningful use is a step-by-step roadmap for how our healthcare system can transform itself to provide higher quality, safer, more patient, more coordinated care. But here's the big change. It's not the $20 billion. It's that health payment is changing to pay for value, not for volume. That means not only is meaningful use the blueprint for how to deliver better care, It's also the blueprint for how healthcare providers can thrive in the new healthcare marketplace. Thank you.